Dr. Manisha. I'm working as a medical lead in the Medical Affairs Division of Specialty Care in Medical Affairs Division of Lupin. On behalf of my division, I extend a warm welcome to all of you in this brief discussion on patient awareness program, PCOD and mental health diseases. So here joining with me is Dr. Sanjeebani Panigrahi, who is very well renowned psychiatrist, and she will take us through this importance of mental health awareness among the patients with PCOD. Welcome, ma'am.
Thank you. Good evening, everybody.
Thank you, ma'am. Ma'am, we all aware that PCOD, the polycystic ovarian disorder, is very complex disorder and it associated with multiple type of the physical and mental health illness. So,
Right.
can you elaborate on us? Is it true that PCOD affect the mental health? And if yes, how this condition affects her mental health?
Actually, it is very common for women suffering from PCOD to also have a comorbid mental health condition. Most commonly seen is anxiety, depression, but there can be other also mental illnesses like maybe OCD, autism spectrum disorder, substance abuse, and different kind of anxiety disorder like panic disorder. And see, there is a lot of correlation because at some level or other, all the hormonal changes in the body, there is a common mechanism because of which PCOD and mental health illnesses are very commonly seen. Around even in some studies, they say that it is around 20 to 40%.
Right. Yes. So, as yes. So, what I understand from this conversation is it's very common, or what you can say, people with this PCOD. Some studies indicate that 3 times more likely to experience the depression and anxiety. So,
Yes.
ma'am, from clinical perspective, what are the common signs and symptoms generally patients present with PCOD, which makes it important to consult psychiatrist? Means, what are the signs symptoms which indicate towards there is some abnormality in the mental health disease or the patient is suffering from?
First, the PCOD symptoms will come like maybe hirsutism or irregular periods, irregular menstruation, or fertility issues will be there, infertility or decreased sexual interest, obesity, androgenism. So because of that, they generally go to a to a gynecologist. And after the initial interview itself, some might report sleep problems, anxiety, irritability, not feeling good about anything, and not able to focus. So these are like patients themselves won't say that I have anxiety or I have depression. They will first consult a gynecologist primarily for irregular menstruation or infertility or decreased sexual desire. But if the gynecologist or the consulting doctor takes a detailed history, then these symptoms can come out, not being interested in work, not able to focus on studies, not feeling that previous kind of joy or interest in things that they had. So these will be the common symptoms. And sometimes there may be secondary OCD, obsessive compulsive disorder, like repeatedly cleaning hands or, obsession with symmetry or repeated checking. So these are the common presentations that we can see in women with PCOS who also present with mental health problems.
So it is very difficult. Means what I can understand from this conversation says that it might be very difficult for that patient to identify whether that patient is affected with mental health, illness or not. So,
Yes.
is it important? Do you feel it is important to treat the mental health awareness or kind of mental health diseases in such patients?
Yes, very much so. If the gynecologist feels that there is some mental health issue, they can refer the patient to a psychiatrist because untreated mental health illness will only aggravate PCOS. And not only PCOS, it will adversely affect the general life of the patient. And unless and until the mental health is treated, the PCOS treatment may or may not work because PCOS treatment itself, they give steroids and all for the treatment, and that kind of even aggravates the mental health even more. So unless the patient takes concurrent treatment, like treatment at the same time for the mental illness is only going to get worse. So it is very, very important to treat it. And that will also improve the prognosis of PCOS also.
Okay. So, at the end, what advice you would like to provide to our viewers on importance of regular mental health conditions and its early detection in patients suffering with PCOD?
I would like to say that when you get a diagnosis of PCOD, you should talk to your treating doctor about feeling about your feelings and how generally your mood is. And even if the treating doctor is not referring and you yourself feel that your sleep is disturbed, your mood is getting affected, your concentration is affected, please consult your nearest psychiatrist, because untreated mental illness will have worse prognosis for PCOD and for life in general. And there is treatment available. It's not like you have to suffer in silence. Please don't suffer in silence. Please don't think that if I go to a psychiatrist, it will be a stigma or it will be a scandal. Nothing like that. Help is available, treatment is available, and with treatment, the outcome and prognosis will be very, very good. So, if you feel that you have any of these symptoms, then please consult your psychiatrist.
Yeah. So very correctly said, because of basically these mental health diseases are considered as something stigma related to a woman's life, and they generally try to hide it. And because of that, it may be a reason for worsening of her condition, not only physically, mentally as well. So very correctly said, and very important part Dr. Sanjeevani has highlighted. So we are very thankful to you, ma'am. And I'm sure our viewers are going to get benefit out of this advice and this dialogue as well. So thank you so much for coming here from your busy schedule and giving us important insights and information about this illness. Thank you. Thank you very much.
Thank you. Thank you. Pleasure is all mine. Thank you.